Well, thank you for inviting me. It's an absolute pleasure to be talking about the abstract that we presented at the 2022 ASCO annual meeting on momelotinib, particularly in patients with thrombocytopenia. This abstract comes from the Momentum study, which is a prospective randomized trial comparing momelotinib versus danazol in patients with myelofibrosis who had previous treatment with JAK inhibitors. And this is another step forward in the development of momelotinib. Momelotinib has also already undergone two randomized phase 3 trials, the Simplify-1 and Simplify-2 study, as well as a phase 2 study specifically looking at the anemia effects of momelotinib. And the reason that we're so focused on momelotinib in myelofibrosis is that anemia is a big problem. It is a diagnostic criteria for diagnosing myelofibrosis. Roughly 40% of patients will be anemic at the time of diagnosis, and another 40 to 50% of patients will develop transfusion dependency over the first year after their diagnosis. So again, anemia is a big unmet need in myelofibrosis. JAK inhibitors that are currently available often suppress the suppress the JAK-STAT pathway, which is key signaling pathway for producing more red cells. So we often see anemia as a side effect of existing JAK inhibitors. Momelotinib is a little bit different because not only does it suppress the JAK-STAT pathway, but it also has this off-target effect on ACVR1, also known as ALK2, which is a master regulator of hepcidin, which is a master iron regulator in our body, and is a key component of the anemia as it relates to inflammation. So by altering the hepcidin levels in patients, we can see anemia improvements. And that's what that phase 2 study that was published in Blood Advances really showed, is that we can impact this anemia in patients and not only potentially control their spleen and symptom burden, but maybe even improve their anemia. So the Momentum study was really the study that was launched in order to show that. And the main endpoints for Momentum were not only symptom burden improvement and spleen volume response, but also freedom from transfusions. Danazol was selected as a comparator arm for this study because if you look at guidelines such as the NCCN guidelines or ESMO guidelines, it does recommend danazol as a treatment for myelofibrosis, particularly when focusing on anemia. So in the results of the main study, we definitely saw an improvement in both spleen volume responses, symptom burden and responses, as well as anemia responses for the study at large. But for our abstract, we want to focus on patients with thrombocytopenia. If we look at Momentum as well as the earlier Simplify trials, these trials included patients with platelet counts as low as 25,000. And would these results hold true in patients who are maybe more myelosuppressed to begin with, even before starting treatment? And really the take home from our subgroup analysis and the ASCO abstract was yes. The analysis of the greater study held true in this subset of patients with thrombocytopenia, that you can deliver momelotinib therapy and still expect very good spleen volume responses, symptom burden responses, and anemia responses in this population. And analyses like these will help inform the submission to the regulatory authorities for approval for this agent, hopefully in the near future. And luckily, and if things go as planned and as we all anticipate, hopefully we can have momelotinib as a new therapy for patients with myelofibrosis in the near future.